The question is the difference between Cyberknife and brachytherapy. So the Cyberknife is basically, it's a linear accelerator. It is an external beam radiation treatment machine. It's what you would get if it's X-rays. The engineering and how it delivers those X-rays is very different than a standard linear accelerator, and I'm not going to get into all of the physics of it, but the Cyberknife is a tool for delivering what's called stereotactic radiosurgery. It can give radiation very precisely and very accurately, and that precision is generally used, whereas a classic radiation treatment course, or what would be considered standard fractionation for radiation, depending on the protocol you're using, maybe anywhere from 4 to 8 weeks. This will treat people in as few as 5 treatment fractions total. It incorporates, real-time tracking. It's got some pretty cool engineering behind it. Brachytherapy is treating the prostate from inside the prostate itself. Generally speaking, for the Cyberknife, you do have to go through a very minor surgical procedure. You do need to put fiducial markers into the prostate, so you have to go through a transperineal implant to put gold markers into the prostate too, so you can track it in real time. But with brachytherapy, it's a surgical procedure. The Cyberknife isn't. With the brachytherapy, the radiation source is actually inside the gland. It's always been my feeling that no matter how sophisticated the external beam treatment is, no matter how cool and accurate, the engineering is behind that to deliver that dose, it's still got to get through all of this tissue to get deep into your pelvis where the prostate is. When you're doing brachy, it doesn't. You're treating from inside the target, and if you look at dose plans from a high dose rate brachytherapy treatment and a radiosurgical treatment, they both look terrific, but the rectal doses are lower with brachytherapy. The integral dose, just how much radiation is your body exposed to, is immeasurably less with brachytherapy. And those are the two biggest reasons that for men with earlier stage or favorable disease, I'm very enthusiastic about it. There are the added advantages, the convenience of being treated in 1 or 2, treatment visits. If you are one of those people who have more aggressive or very high-grade prostate cancer, there is more and more evidence that by incorporating brachytherapy into the treatment, the cure rates are actually higher. So I have different reasons for using brachy on different patients, but it's the longer I practice, where I used to present it as more of an option, I definitely have more of a bias. I think there's more evidence and more rationale for using brachytherapy in appropriate patients. Now, not everybody is a candidate for brachytherapy, and there are different things we look at. Some people are more well suited to external beam radiation, and we obviously make that decision on an individual basis.